Welcome. I'm Terry Tropin, and today I'll be discussing the changes to the ICD-10-CM codes for 2025. These codes are effective October 1, 2024. I discussed the changes to the guidelines in another video. This is a discussion of the changes to the codes only. First, let me start with a little information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have an RHIA and CCSP certifications. I'm an AHEMA approved ICD-10-CM and PCS trainer. I taught for 20 years at Montgomery College in Maryland. I also have written some books on coding. These I wrote because I thought the textbooks were not very helpful in many cases. So I wrote these books. I wrote study guides for my students, which became these books. I've written a book on evaluation and management coding, a book on CM coding, a book on PCS coding. And then you may wonder what's the difference between the 2024 book and the 2025 code books. Is there really enough changes to justify spending all that money for the differences? Are the differences enough to justify the big expense? Well, the answer is yes. And to show you what the differences are, here's a book on the changes between the 2024 and the 2025 books. Now, these books are available on Amazon, and they're updated every year. So let's look at what we're going to talk about in this video. There are changes in all of these chapters: Chapter 2, Chapter 3, Chapter 4, Chapter 5, Chapter 6. So the first 6 chapters, not Chapter 1, but 2, 3, 4, 5, 6, Chapter 9, 10, 11, 12, 13, and then we skip to 17, 18, 19, and then skip to 21. So let's get started. First of all, let me say changes are in bold. Deleted information is crossed out. Now, I'm not talking about every single change because that would take like 3 hours. So these are the main changes. So see the link in the description of this video that will talk about all of the changes that are in for 2025. Okay, let's start with Chapter 2. The Neoplasm, in categories C81, 82, 84, 85, 86, and 88. These categories were expanded to include new codes for in remission and not having achieved remission, meaning not in remission. So again, as always, every year the codes get more and more specific. So these are codes for Hodgkin lymphoma, follicular lymphoma, mature T and K cell lymphomas, other specified and unspecified, malignant immunoproliferative diseases, and certain other B cells lymphomas. So more specific codes to indicate whether the condition is in remission or not having achieved remission. Important information to have document in a patient's file. Now, also categories C86 and C88, which are also lymphomas, include codes for in remission, not having achieved remissions, but also failed remission. So this means that a person has not achieved remission after treatment. So they've been treatment, but the treatment's not working. So this is C86, other specified types of T and K cell lymphoma, and T88, malignant immunoproliferative diseases, and certain other B cell lymphomas. So these have in remission, not having achieved remissions like the previous one said, but also failed remission. Okay, so that's Chapter 2. So Chapter 3, Fanconi anemia, was an inclusion term under D61.09, so you can see it right here. So now, for 2025, it has a very own code of its own, D61.03, Fanconi anemia. So what is that? Was a rare inherited condition affecting bone marrow and other parts of the body. And here, which is kind of a weird picture, is what's included. So hypoplastic thumb, cafe au lait spots, low sets of ears, anyway, vitiligo, certain conditions. Okay, so now we're going to move on to chapter 4. This is an important change in chapter 4, the endocrine system. So we have pre-symptomatic type 1 diabetes. This is E10.A. So this is a very, very early stage of type 1 diabetes, pre-symptomatic. So you have a normal glycemic, pre-symptomatic, you have dysglycemic, pre-symptomatic, and then you go into dysglycemic, symptomatic. So it's type 1 diabetes, but it's pre-symptomatic. The patient does not yet have any symptoms of diabetes yet, but they have the type 1 diabetes. So this is important so they can start treatment early. E10.A0, A1, and A2. So type unspecified stage 1 and stage 2. So this is a brand new category or subcategory. So also added is E16.A, and then you have A1, A2, A3, hypoglycemia level 1, level 2, level 3, and this is level 1 is mild, level 2 is moderate, level 3 is severe, and here you have a list of what does that mean. Well, level 1 is considered important. Level 1 is recognized as threshold for neuroendocrine response to falling glucose in people without diabetes. Level 2, you have neural symptoms to begin to occur. Level 3, this is very serious, can progress to loss of consciousness, seizure, coma, or death. So it's based on blood glucose level 1, level 2, level 3. So that's another brand new subcategory. Like I said, if it's in bold, that means it's new. If it's crossed out, that means it's been deleted for 2025. Okay, now additional code for hypoglycemia level, if applicable, that E16.A was added as a use additional code note under these subcategories. E0864, E0964, E1064, 1164, 1364, E16.0, E16.1, and E16.2. So this is a new note under all of these diabetes codes and other hypoglycemia codes, the E16 codes. So look for this new note under these codes. Okay, so category E34.0, carcinoid syndrome, also in chapter 4, was expanded. It refers to carcinoid syndrome. It's a rare cancerous tumor which secretes chemicals into the bloodstream. It's a type of neuroendocrine tumor. Mostly occurs in the gastrointestinal tract or the lungs. Before it was only E34.0, but it's been expanded to carcinoid syndrome unspecified, carcinoid heart syndrome, and other carcinoid syndrome. And here's a, you can see from the picture, the manifestations of this syndrome. So again, more specificity. Also in chapter 4, so we got a lot in chapter 4, you have obesity classes. E66.81, class 1, 812, class 2, 813, class 3, and then not elsewhere specified, of course. And these are all based on body mass index. You can see the BMI class 1, 30 to 34.9, class 2, 35 to 39.9, and 40 or more is class 3. So this is more specificity in under E66.81. Okay, also in chapter 4, we got a lot in chapter 4. E84, other disorders of carbohydrate metabolism. E84.8, other specified disorders of carbohydrate metabolism. A new code added under that, E84.82, or disorders of citrate metabolism. They added that code, and then under that code, E84.820 and 829, citric transporter disorder and other disorders of citrate metabolism. The citrate transporter disorder can lead to liver failure or low calcium concentrations, which of course can affect bones. So you can see from the picture, this can affect nerves also. Liver failure, low calcium concentration. So this is serious stuff. So they added a code to capture that information. Okay, also in chapter 4, E87.0, hyperosmolarity and hypernatremia. This is important. It excludes 1, replaced with an excludes 2. That's very important, very easy to miss. Remember that an excludes 1 means you can't report these 2 codes together. An excludes 2 means that maybe you can report the 2 together if it's documented. There are a number of these codes for 2025 where an excludes 1 has been changed to an excludes 2. So pay attention to these because it means makes a big difference in your coding. So now diabetes with hyperosmolarity can be reported with hyperosmolarity and hypernatremia. So it's now an excludes 2, diabetes with hyperosmolarity. Can be reported if documented with E87.0. Very important. And there are a couple more of those coming up. Okay, so also in chapter 4, like I said, a lot of stuff in chapter 4. E88.8, E84.82 has been changed, has been added. Obesity due to disruption of MC4R pathway. This is a key component of the central hypothalamic regulation of hunger. My husband thought this was great. This means he has an excuse for eating when he should stop. Not an excuse. Key component of the regulation of hunger, disruption leads to hyperphagia, eating too much. Not an excuse. Use additional code for polyphagia. Use additional code to identify body mass index if known. So you can see here from the picture, the pathway going this way, and it's blocked. You're still hungry. So those messages saying I'm full is blocked, so you still think you're hungry. Interesting. Very interesting, I think. Okay, so finally we're done with chapter 4. We're going to chapter 5. More specificity in the codes for anorexia, bulimia nervosa, and binge eating disorder. New codes for under these sections for mild, moderate, severe, extreme, and in remission. So you have new codes under these. Again, specificity. New code for F50.83 pica in adults. That's a new code. And then you have the F98.3 pica in infancy and childhood. So you have specific codes for infancy, childhood, and then a code for adults. Pica, of course, is eating things not usually considered food, like eating dirt, eating paste. Kids sometimes do that in school. Eating ice, things like that. Okay, rumination disorder in adults, rumination disorder in infancy and childhood. So again, this is differentiating. New code for rumination disorder in adults, and then F98.21, rumination disorders in infancy, and they added childhood. So you have infancy, childhood, and then you have a new code for adults. So what's rumination disorder? Worrisome thoughts giving excess analysis, kind of going over and over, replaying conversations, trying to understand what went wrong, worrying about upcoming results and upcoming events and obsessing over them. This this is going to happen. What should, I could do this, I could do this, worrying about them, obsessing over what's going to happen. Okay, moving on to chapter 6. So a new code under other epilepsy and recurrent seizures. G40.84 KCNQ2 related epilepsy. This is a gene that provides instructions for making potassium channels in the brain cells. When these channels are not working properly, brain cells produce too many electrical signals, which can lead to seizures. And you have codes that are this for not intractable with status epilepticus, not intractable without status epilepticus, intractable with status epilepticus, and intractable without status epilepticus. So this is a whole new set of codes under the other epilepsy and recurrent seizures category. Okay, also under chapter 6, other disorders of autonomic nervous system, serotonin syndrome, and you can see from the picture too much of the neurotransmitter serotonin in the body that can make changes to the mental state, dry mouth, sweating, fever, hypothermia, shock, diarrhea, nausea, tremors, reflex changes, muscle rigidity. So under other disorders, you have a new specific one, serotonin syndrome, G90.81. It has a lot of notes under this, so be careful with this code first. Use additional code, lots of notes to keep aware of. Okay, also under chapter 6, so this has almost as many as endocrine system, doesn't it? G93.45, developmental and epileptic encephalopathy. Early infantile epileptic encephalopathy, rare genetic neurologic disorder that causes seizures and developmental delays in children. Code also, and there's a list of other things to code in addition to this. This is called DEE, developmental epileptic encephalopathy. So it occurs in infants, and you can see early infantile. So it has a long list of other things that can be associated with it. You can code also for those. Okay, so now we're moving on to chapter 9. So IO8, multiple valve diseases. So again, this is an excludes one note, changed to an excludes two note. Easy to miss, but very important. So you can now code these with other codes in the IO8 category, when before you could not. Very important to make a note of that. Also in chapter 9, I26.0, pulmonary embolism with acute core pulmonale, I26.09, cement embolism. This is, when I looked this up, I went, oh my God. Cement used in vertebroplasty or chiroplasty leaks out and enters the venous system and travels to the lungs. So you get a repair of a vertebrae. Some of the cement used leaks out, goes into the venous system, travels to the lungs. So that's an embolism, right? So it can be with or without acute cor pulmonale. So, code first, if applicable, complication of other artery following procedure. And anyway, cement embolism. Also new codes for fat embolism, I26.04, I26.96, code first, complication, and then traumatic fat embolism. A traumatic fat embolism is after a major injury, such as a broken bone, so it's not always after surgery, after a procedure. Okay, also in chapter 9, you have again an excludes one note, change to an excludes two note. Excludes one note for aortic valve disorder of unspecified cause with diseases of medial and or tricuspid valve. That's changed to an excludes two note. So that's an important change, easy to miss. Okay, moving on to chapter 10, respiratory system. Again, excludes one, change to an excludes two. Abscess of lung with pneumonia. Aspiration pneumonia codes, plus lipid pneumonia and pneumonitis. These were excludes one's code, now they're excludes two. So can be reported together with J18 codes. Okay, moving on to chapter 10, disease of respiratory system. So this is J34, nasal valve collapse. So a weakness or narrowing of the nasal valve. The nasal valve is the narrowest portion of the greatest overall, with the greatest overall resistance to the airflow, and you can see that here. It can be static or dynamic. So it collapses, and of course it's much more difficult to breathe. So nasal valve collapse, and you have nasal valve collapse, code first underlying cause, may be caused by a deviated nasal septum. Separate codes for internal and external, separate codes for static and dynamic. So the nasal valve collapse, all of these codes are brand new. They're under other specified disorders. Okay, chapter 11, disease of the digestive system. Lots of codes for fistula. So this is anus and rectum. Anal fistula. You have unspecified, simple, and complex. Under simple, these are all new. Unspecified, simple, complex. And under simple, there are codes for initial, persistent, recurrent, and unspecified. Under complex, there's codes for initial, persistent, recurrent, and unspecified. These are inclusion terms. Under rectal, and here's the division between rectal and anus, you have again unspecified, simple, and complex new codes. These are inclusions, and you have new codes for initial, persistent, recurrent, and unspecified. You have complex new codes for initial, persistent, recurrent, and unspecified, and these are inclusions. And you have anal rectal fistula. So you have unspecified, anal rectal fistula simple, inclusion terms, codes again for initial, persistent, recurrent, chronic, unspecified. Anal rectal, inclusion terms, initial, persistent, recurrent, chronic, unspecified. So lots of specificity added to the fistula codes. Okay, skin and subcutaneous tissues. So under other pruritus, you have cholestatic pruritus. This is associated with itching related to liver disease. So code also, if applicable, type of liver disease. Use additional code for adverse effect, if applicable, to identify drug. And then you have other pruritus, and you have cholestatic pruritus, and then other pruritus. So that's a new code. The cholestatic pruritus is new. Okay, also under chapter 12, diseases of skin and subcutaneous tissue, you have lichen planopilaris, and very specific codes under that. Very specific. So it used to be just lichen planopilaris, and then you have very specific codes: follicular, frontal, other, and then you have scarring alopecia, very specific codes. Okay, moving on to chapter 13. So we're kind of hitting a little bit in each chapter. Under M51.3, other thoracic, thoracolumbar and lumbosacral intervertebral disc degeneration, they added codes for specific regions, for lumbar region and lumbosacral region, and specific areas for pain, back pain, leg pain, lower extremity pain, axial back pain, sclerotomal pain. So again, very specific codes within this. Added additional codes for more specificity. So multifidus muscles. Added code for that under M62.8, other specific disorders of muscles, disorders of the multifidus muscle in the lumbar region. This is muscle that stabilizes the core and protects the spine during movement. So this was added under other specified. And here it is right there. Right there. Okay, M65, synovitis and tenosynovitis, added codes for specific sites: shoulder, upper arm, forearm, hand, thigh, lower leg, ankle, and foot. Also codes for right, left, and unspecified, other side, and multiple sites. So lots of additional codes for, again, specificity. Every year they get more and more specific. Okay, chapter 17, congenital malformations, deformations, and chromosomal abnormalities. So this was an inclusion term under Q23.1, congenital insufficiency of aortic valve. So this was deleted as an inclusion term, and they added its very own code for itself. Q23.81 under other congenital malformations. So bicuspid aortic valve malformation now has its own code. And so it has these inclusion codes, and it also has a code also note under that. So it has its own codes, be much more specific when coding it. So under Q23.1, congenital insufficiency, bicuspid aortic valves, Q23.82 gave its own code, Q23.88, other congenital. So congenital insufficiency of aortic valve gave its own code, and then did another code for other. So one of the mitral valve leaflets has a slit-like hole or defect, and means the blood's flowing backwards, regurgitation. Okay, so new code for Fleistra syndrome. Q87 is the category. Q87.8, other specified congenital malformation, not elsewhere classified. They added a specific code under that, Q87.86, Kleefstra syndrome. And here's some of the characteristics of patients with the syndrome. Okay, moving on to chapter 18. I found this fascinating. Other symptoms and signs involving cognitive functions, R41.84, and then we have R41.85 was added. This is on the synostia, R41.85. This is fascinating. This is lack of awareness or insight. The patient said, I'm not sick. There's nothing wrong. So they're not going to not get treatment. They're not going to take their medicine. They're very common in schizophrenia, also Alzheimer's. They say, I'm not sick. There's nothing wrong. Bipolar. Their patient will not admit that there's something wrong, and so they're not going to take their medications. Fascinating. I didn't know there was a term for that until I saw this. Fascinating. Okay, so now we're going to move on to chapter 19. So this is a new code in this subcategory. T45.A, poisoning by adverse effect of underdosing of immune checkpoint inhibitors and immunostimulant drugs. This is a drug used to treat melanoma. It's a type of monoclonal antibody treatment. So also in Chapter 19, disruption of internal operation surgical wound not elsewhere classified. You can see that all of these were inclusion terms here, and they have been given their own terms. So now they have their own codes, most of them. T81.32, disruption or disease of the gastrointestinal tract. Disruption or disease and closure of other specified internal operation wound. So some of them have inclusion terms under other things, so they don't all have their own very own codes, but they have been broken out into some of them. So these were inclusion terms, these were all deleted, and they added new codes. Okay, Chapter 21, factors influencing health status and contact with health services, Z codes. So under Z15 was added a code, Z15.2, genetic susceptibility to obesity. Interesting. Code also, if applicable, manifestations such as other obesity, E66.8, and polyphagia, R63.2. Use additional code to identify body mass index, if known. More and more discovering that obesity has some genetic aspects to it. Okay, also Z17, they changed the title of the category. You see that in bold here. It used to be estrogen receptor status, and now it's estrogen receptor status and other hormones and factors receptor status. They also added some note. Use one code as available for each receptor. Z17.0, Z17.1, Z17.2, Z17.3. Okay, so you're going to code very specific. Also in notes says code first malignant neoplasms such as malignant neoplasm of ovary. So you're going to code as many receptors as are documented, and then you're going to code first the neoplasm that's related to the estrogen receptor. So there's Z17.2 progesterone receptor status, and then you have a 2122. You have Z17.3 human epidermal growth factor 2. And you have a 3132, and Z17.4 combined receptor status. And then it says, note, assign a code from subcategory Z17.4 when only a combined receptor status is documented. So if that's all you know. So it's very interesting as they learn more about these estrogen receptors, they're going to make these more and more specific. And here's some more. Z17.41, HR positive, C17.42, HR negative, and you have codes under that. Very, very specific. They're learning so much about this stuff. Now, this is interesting that they added under encounter for other aftercare and medical care, they added a code, Z51.A, encounter for sepsis aftercare. Very interesting. Now this, sad but true that this was necessary, Z59.7, insufficient social insurance and welfare support. Z59.71, insufficient health insurance coverage. Sad but that we have to have a code for that, but we do. Z59.72, insufficient welfare support. Sad but true, but it's interesting that they have new codes for that now. Okay, the Duffy phenotype. This is a minor blood group antigen associated with transfusion reactions. It occurs in associated with African or Arab ancestry. Okay. So it involves with the neutrophil count. Sometimes it's problems, sometimes it's not. It depends. But anyway, so there's new codes for the Duffy phenotype. Here. Interesting. So family history of diseases of the digestive system. So they added new codes for family history of familiar adenomatous polyposis, and then personal history of colon polyps and different kinds of polyps. Because family history of benign neoplasms could be anything. So they made it more specific that it's polyps or polyposis. More specific. Okay, so that's the video. So if you'd like a copy of the slides for this video, send me a note with your email address and I'll send you a PDF of the slides. For an overview of all the guidelines related to 2025, see my video on the guidelines. So again, here are my books, and those are available on Amazon. If you have comments or questions, here is my email address. And remember, my books are updated every year. I have the 25 books for these. This should be up the end of August, hopefully. This one will be up. The changes haven't been posted yet, but as soon as they are, I will get that up to you. So let me know if you have any questions. I hope this was helpful. Watch those excludes 1 to excludes 2. Those are so easy to miss, but they're so important. Thank you for your time. Thank you.